Well, first off, you know, uh, your reaction to the news of this leak last night. I know it was something we previously discussed, was something that you kind of were preparing for quite some time, but just initial reactions.
It's disappointing. Let's be clear that this is just the beginning. The majority of the court is attacking the right to abortion, which we see as essential health care and we are proud to provide. Those opposed to safe legal abortion have already signaled that they're going after birth control, they're going after gay marriage, and they're going after transgender people. So it's really disappointing for our community to know that we're here, we're sitting in the reality of it. I think it's a lot different to speculate this could or couldn't happen, but we're here and we've been preparing for this moment. And so what happens next is we need to make sure that we're providing care to anyone that comes to a Planned Parenthood Mar Monte Health Center.
Talk to us about the most immediate impacts, which is there are some folks who have been impacted by the decisions made in Texas who have already come to Sacramento. What has been, can you tell us how many patients have come, at least to Sacramento from out of state, and what the need has been just in the immediate changes, even before any type of, major federal decision on this?
Absolutely. It's unacceptable for anyone to be forced to travel from their home to exercise their constitutional right to essential health care, because currently abortion is still law of the land. At Planned Parenthood Mar Monte Health Centers between July 2021 and April 15th of 2022, we've provided abortion care to 80 patients from out of state. 29 of those patients who've traveled from Texas did so after SB 8 went into effect. And ultimately, the reversal of Roe could drive up the number of out of state patients whose nearest abortion provider would be in California. So, roughly, with Roe in place, that's about 46,000 people. Without Roe, that's about 100, or excuse me, 1.4 million folks coming to California for services.
That is seems like a dramatic increase on services that already in some cases are stretched thin, especially depending on where you go, even in California.
Yes, for sure. It's already a challenge to seek these services in California, mainly in our Central Valley health centers. I mean, the distance between health centers is a great barrier, and many of our patients are low income and people of color. They may have experienced some sort of interpersonal or domestic violence, and so that challenge continues to be a problem, and then it's further exacerbated by more folks seeking care here in California. And Planned Parenthood Mar Monte has been working towards this moment. We are expanding access to care by having more clinicians, more providers, renovations to our health centers to make sure we have more exam rooms for patients. And so all we can do is continue to expand and make sure that that our services are not impacted for Californians and that we have more space and are available to those who seek care here in California.
There are folks who have experienced things like domestic violence or interpersonal violence or reproductive coercion, who may be seeking abortion, may have to come from out of state and into California to get services if this uh, leaked ruling passes, which I think many have speculated it will. What are some of the challenges for folks that would have to come to California in those situations, in terms of, I suppose, resources, even being able to get there, and some of the additional barriers on top of what they already might be going through? Uh,
Let's be clear that this is just the beginning. And the thing about it is, abortion bans don't take the need away for abortion, right? They simply make it very unsafe. And people who cannot afford to access abortion in the state where they live will also be subject to these hardships. And so people who are already in poverty will be most impacted by this decision. And so folks who are coming from out of state will experience great barriers, mainly around transportation, lost wages, childcare, the whole patient navigation. When someone comes to a Planned Parenthood Mar Monte Health Center, they're getting care, but they're also getting wraparound services. So we provide telehealth resources, and we'll provide interpersonal violence screenings. And so we're looking at a new way of doing that across state borders. And we knew, unfortunately, this was coming. And so we've been working on an infrastructure to be able to support those patients. And hopefully, we're able to meet the need and provide care for everyone.
Obviously, we know a lot of the infrastructure is kind of already in place. There may be a need for funding, especially down the line, especially essentially if we're starting to create a pipeline of folks coming from out of state to get services. But can you talk about the challenges from your perspective in terms of, say, someone calls you from Texas today? What do you have to do to even be able to get them here? To be able to receive services.
Absolutely. Planned Parenthood Mar Monte between July 2021 and April of this year had provided abortion care to 80 patients from out of state. 29 of those folks have traveled from Texas, and they did so after the SB8 ruling went into effect. So typically, out of state patients are going to call, and they have real needs and concerns, and so we help with the wraparound services. When someone calls, they need patient navigation, they need childcare, transportation. We may connect them with a local abortion fund, and then we try to see them immediately as possible. And so I think the challenges of doing that is we don't know the number of folks that will be coming to us. And so our hope is that we're able to care for those coming to California through the investments of the state budget. And the Women's Caucus has produced an amazing legislative package that will allow us to expand care, not just to folks from out of state, but also maintain and protect what Californians here are able to access.
Some of the challenges that and roadblocks that organizations such as yourselves or even other organizations that kind of do something similar but also different, like DV, aid resources, places like Weave. What do you expect some of the challenges are going to be for you all potentially moving forward if you have, say, a surge of people coming from out of state, if big changes like Roe v. Wade gets overturned?
I think the challenge is just making sure that we're there to provide the care. This is not going to be just a Planned Parenthood approach. This is going to be a people approach. And what we put first is our patients. Our patients don't care who we are, they just want to be served. And so, if that means we need to have a robust network of community organizations to provide some of that wraparound care, we will build the infrastructure. And we're not starting from nowhere. We have been working tirelessly with organizations on the ground in Sacramento and throughout the service area to be able to figure out what that infrastructure looks like. But we all have a role to play in making sure that folks can get the care they need, and the sexual and reproductive health care, including abortion, is accessible and everything that comes with it. Because folks are not just coming to get care, they're people. And we have to put our patients first and lean on our community partners to step up if we feel there's a role for them to play as the leaders in that space, whether it's domestic violence or other things that folks experience, like our LGBTQ patients who may need those services. We're all intersectional, all humans, right? So we just want to make sure we're taking care of the whole person, and we'll work with the community to do that.
We've seen in the past couple of years, especially during the pandemic, issues of domestic violence really increasing in our country. What do you suspect if this Roe v. Wade is overturned, a greater impact on folks, not only maybe seeking abortion services or other services in California, but folks who are experiencing interpersonal violence? Do you expect it to potentially get worse, especially in those states that are likely to trigger laws that could essentially criminalize or illegalize abortion?
I wish I had a crystal ball for that question, but I do think, as we know, that these abortion bans and these lack of access definitely impact women of color. They impact poor folk. They impact people that are already marginalized, people that are already being burdened by systemic barriers. And so you can only imagine that those things will still increase, right? So homelessness, domestic violence, all of the things that folks experience are still going to be happening in addition to them trying to seek an abortion or trying to seek care. And so we will play our role to make sure that our doors are open, our clinicians can provide the care, whatever we can do to support our community. But we certainly know that this is just a devastating time for folks of reproductive age. And I don't have all the answers, but I do know we have been working towards this moment, and our doors will always be open in California and Nevada. And however we can serve and help our patients, we are more than willing to step up and do so. It feels like a very sad time in our history. As someone who's a young person, this is the first time I've ever lost a constitutional right, but I'm motivated and hopeful because we can be different. We can be the leaders in California, and if we get it right, that can open the doors to many other states. And so don't lose hope, and just know that we can use all the support we can to support people here in California and those who seek to come here as a reproductive freedom state.